and I'm going to be doing your assessment of your heart. Okay, so for the heart, like obviously we need the anterior thorax. Okay, so this is the anterior thorax. So we're focusing on the anterior thorax. So what are we looking for? At the same time, the neck is included because the carotid artery is there, and then the jugular vein is there. So like both structures tells us about the wellness of the heart. All right, so right now, like I'm looking, it's the anterior thorax is symmetrical. So obviously the heart is on the left side, so I'm focusing on the left side, and I'm looking, it's symmetrical. Then the other structure that I'm interested is the PMI, which is the point of maximum impulse. And so that's the tip of the heart that, you know, like when the left ventricle is contracting, so that's the tip of the heart that is dancing. The only time I see it, like when the patient is very thin, like who have like growth spurs, like those 14 years old, 16 years old, they don't have any meat on their chest, so you can't see it. But for women, it's always masked with the breast, so it's not going to be, I'm not going to be able to see. But it's still kind of, I'm looking. All right, so then the other thing that I'm going to be looking now is the neck. I don't see any unnecessary pulsations, you know, so like nothing, I don't see anything, you know, so like I'm assuming that the carotid artery is pulsating regularly, and I don't see with JVD, at least now, like with my naked eye. All right, so I'm done with my inspection. So the other thing that I'm going to be doing now is palpation. So palpation means that I'm touching. All right, so what am I touching? So if the heart, if I was going to buy a box and then place the heart into a box, the shape of the heart is triangular. So there is the apex, which is the tip, and then that apex is going to be fitting. This is the clavicle, mid clavicular, all the way fifth intercostal. Fifth intercostal, can I lift that? Okay, so fifth intercostal is just like this bra line. You're just, sorry. So just bra line, just you lift and then you put your finger there. It's so easy to find it. So that is the fifth intercostal, and this is the mid clavicular. Wherever I'm pointing, that's your PMI, which is the point of maximum impulse. All right, so that's the tip of the heart, and then when the left ventricle pumps, that tip dances. All right, so dances, like it's a movable tip. All right, so now that's the point of maximum impulse. So the fifth intercostal mid clavicular. And then the other thing that I'm gonna be palpating is, okay, so I'm gonna be placing my hand, all right, to cover the point of maximum impulse. So when you're looking, so like my pinky is like below the bra line. So that will cover the PMI. Do you see it? All right, so that, and you know, like I'm just like putting my hand very softly, and then I'm just looking if I'm feeling any thrills, heaves, or any lifts. What does this mean? It means that if there is any movement, simply. So I shouldn't be feeling any movement, because if there is movement, so what does that mean? It means that there is leakage, or leakage of the blood going backwards as far as the valves, and it creates murmur, and then also murmur is upon auscultation, and thrills, heaves, or lifts upon palpation. So what I do, like I put my hand like this and put again on top. Do you see it? So this way I covered. So I covered the base now. All right, so at the beginning I covered the apex, now I covered the base. That's it. The heart is already a fist size, so I covered it. Are you with me? Right, okay. So now the other thing that I'm gonna be doing, like I go this time like vertical. Okay, so this is the sternum, so like I'm going vertical. This is like, if this is the base and this is the apex, I'm covering it. Do you see? It's like softly you have to put it, then you, okay. Do you see? So this way, what did I do? I engulfed the heart. All right. So I put 4 positions so that I didn't miss any movement, any thrills, heaves, or lifts if it is present. Okay. I'm done with my palpation. So if I want to do the palpation of the carotid, you can do it, because the carotid belongs to the heart also. So why carotid is important? Because the left ventricle, when it sends the blood out, so with the carotid, it goes to the brain. So the carotid is only avenue to go to the brain. So this is a good time to check the carotid artery. can feel it very well. Okay, then okay, I can feel it. It's +2 and it's strong. Okay. So I'm done with the palpation also. So the next thing I'm going to be doing, if I'm going to be following the order of physical assessment, so there is percussion, but we're not going to be percussing the heart because it doesn't have much of a value. X-rays shows enlargement of the heart more clearly, and X-rays are cheap. All right, so now, so we're passing percussion, so we're going into auscultation. So with the auscultation, I need the stethoscope, right? So I have a stethoscope, and then the stethoscope has the diaphragm and it has the bell. All right, so we're going to be using both. All right, so with the diaphragm, we're going to be identifying S1 and S2, which is the S1 is the closure of the tricuspid and mitral valves, and then S2 is the closure of the pulmonic and aortic valves. All right, S3 and S4, it is present, but we don't hear it. All right, so because if we hear it, means that there is a disease process. Okay, so now, next I'm going to be doing, I'll put this, and then okay, so I have the diaphragm, I tested it. All right, so where do I go? Second intercostal, so this, it's going to be here. All right, so this is the aortic. You can press, it's not going to hurt. All right, so this is the sternum, right sternal border, second intercostal. So I move this and then I go this way. Do you see it? Okay, S1 and S2 is distinct, there is no murmur. Okay, this time I'm going to be placing the stethoscope in there. Okay, it's okay. All right, so now I remove this. I have to be on the same vertical line, right? Look where I put. I didn't even touch her breast. Do you see it? Do you see how it goes? Mm-hmm. Very careful. I'm not even touching or anything. Okay, so this is the tricuspid and it's on the fourth intercostal space. Okay. I'm gonna lift your bra up. Is it okay? Okay, so, and then you move this and then you put it this. Do you see it? I mean, the breast is not touched, really. Okay, so what is this? The mitral. And at the same time, it is PMI is here too. All right, we're done. I can hear like S1 and S2 distinct. There is no murmur. All right, so this time I'm gonna be changing, and I'm gonna be checking with the bell. The same landmarks. This time I'm just making sure that I didn't miss any murmur. So second intercostal space. Right sternal border is the aortic. Left intercostal space is pulmonic. Okay, Sophie, I'm gonna go inside your bra. Very careful. So that's the tricuspid fourth intercostal space. I didn't hear any murmur. And then I'm gonna lift the bra a little bit and then put it here. And this is the fifth intercostal space, mid clavicle. So that's the mitral valve. At the same time, it is a PMI. Okay, since I'm doing the PMI, point of maximum impulse, and I'm going to be checking the carotid artery to make sure that they're synchronous, and they are. Okay, it's synchronous. Okay, all right, this is it, I'm done.